Blood gas analysis. Laboratory studies of arterial and venous blood for the purpose of measuring oxygen and carbon dioxide levels and pressure or tension and hydrogen ion concentration, pH. See accompanying table. Analysis of blood gases provide the following information. PaO2, partial pressure, P of oxygen, O2 in the arterial blood, A. SaO2, percentage of available hemoglobin that is saturated SA within the oxygen O2. PaCO2, partial pressure, P of carbon dioxide, CO2 in the arterial blood, A. pH, the expression of the extent to which the blood is alkaline or acidic. The PaCO2 is related to the pH of arterial blood because of the chemical reaction of carbon dioxide and water, which results in the formation of carbonic acid. The presence of an elevated PaCO2 results in an excess of hydrogen ions, which indicates a lowered pH and acidosis. See also pH. Analysis of blood gases and determination of pH levels are useful in assessing patient status in conditions affecting the transport of oxygen and hemoglobin, as in respiratory and circulatory disorders, as in those cases in which there is a disturbance in fluid and electrolyte imbalance and malfunction of the body's buffer systems. Because the lungs and kidneys act as regulators of the acid-base balance, care of the patient with any disorder seriously affecting the functions of either of the organs would include periodic blood gas analysis. The manner in which specimens of blood for blood gas analysis are obtained is important in the accuracy of test results. Arterial blood samples may be taken from the indwelling arterial catheter or by femoral puncture performed by a physician. Because peripheral venous blood does not usually present a true pH, electrolyte, or gaseous picture, it is recommended that a sample of venous blood collected for analysis of these factors be drawn from a central venous catheter or from a catheter in the pulmonary artery. During the process of drawing blood for gas analysis, care is taken to avoid getting any air bubbles into the sample. The amount drawn may vary from 0.5 milliliters to 2.5 milliliters, depending on the type of analyzer used in the laboratory. The sample usually is collected in a heparinized vacuum tube or plastic syringe. Heparin is used because unclotted blood is needed for the analysis. Care is exercised in the strength and amount of heparin used because heparin is in excessive amounts will cause falsely low blood pH values. It is extremely important that the container for the blood sample be labeled correctly. Values and norms for venous blood and arterial blood differ. Therefore, the container should indicate the source of the blood sample, and this information also should be written on the report of the results. Measurements of the PaO2 and the SaO2 are both concerned with oxygen transport in the blood. PaO2 represents the oxygen dissolved in the blood, which is a very small amount. The oxygen in combination with hemoglobin, or oxyhemoglobin, the form of which most of the oxygen in the blood occurs. Adequate oxygen transport therefore depends on a normal amount of hemoglobin, and normally functioning hemoglobin, both PaO2 and SaO2 levels must be examined to determine the adequacy of oxygenation. It is important to remember that although the normal PaO2 is 80 to 104 millimeters, Hg, some patients with chronic obstructive pulmonary disease can tolerate a PaO2 as low as 70 millimeters. Hg without appearing hypoxic. In caring for patients with this condition, it is important to know that attempts to elevate PaCO2 level to normal laboratory range can be dangerous and even fatal. It is best to establish a normal level for each individual patient before supplementary oxygen is administered, and then to assess his condition on the effectiveness of therapy according to that baseline. Measures that will raise the PaO2 level include administration of oxygen and changing body position so that there is improvement in pulmonary circulation with increased oxygenation of the blood, returning to the heart from the lungs. The PaCO2 defines adequacy of ventilation. If carbon dioxide, which is the end product of all body metabolism, accumulates in the body because it is not blown off by the lungs, the patient will develop acidosis. Well, this sounds like how people died from the ventilators. Too much air. that messed with their blood. It tells you right here. Okay? It'll kill you if you try to fix it. Everybody has a different level, a normal level. So it's like I don't know how we missed this. This is in the 70s, this book.